Welcome, everyone, to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Medical marijuana is marijuana that is used to treat pain, nausea, and other side effects of some treatments, as well as some disease symptoms. Medical marijuana is legal now in over half the states and in Washington, D.C. Each state has legalized or that has legalized marijuana for medical use, regulates who may use it and how the product is distributed within its borders.
Recently, there's been a discussion about whether medical marijuana could be the answer to the opioid epidemic in this country. Senator Elizabeth Warren has asked the Centers for Disease Control to explore the use of medical marijuana as an alternative to the powerful opioid painkillers that result in thousands of overdose deaths each year.
So no more oxycodone. We're going with marijuana, huh?
We'll find out.
Well, here to discuss the use of medical marijuana is internal medicine specialist and addiction specialist, Dr. John Ebert. Welcome back to the program, Dr. Ebert. Good to have you.
Pleasure to be here again.
So I have always been under the assumption that if this many states, half the states in America, have legalized marijuana, that everybody, including the medical profession, must think it's safe.
So that's a really great question. I think that we do need to sort of separate the issue. Some of what we're hearing and some of the rhetoric we're hearing is really about recreational use too. And so I want to be very clear about what we are talking about, which you've said.
Yeah, Colorado's so different than Minnesota's situation.
Right. So if you look at the 4 states that have legalized it for recreational use, Washington, Oregon, Alaska, and Colorado, very different issues. So we're really focused, as you mentioned, Tom, on that the medical marijuana piece that half the states in Washington, D.C. have approved of. So once you get beyond that, then you really need to talk about what exactly is the drug we're talking about. We mentioned medical marijuana, but we're really talking about really 2 genus or species of cannabis, and one is cannabis sativa and one is cannabis indica, and those are the 2 main strains. When we talk about marijuana, it's complex because there's over 400 chemicals in medical cannabis, and 70 of them are cannabinoids. Most medications that we prescribe in medical practice have no more than 2 medications, if you think about a combination blood pressure medication, for example. But these have over 70 cannabinoids in them, and all of them, and there are different cannabinoids, and they have different effects.
So you're saying that medical marijuana is different than recreational marijuana?
Yeah, so and it's really important to have that clear distinction because the rhetoric does sort of get confused, and I think that when you look at the way that certain physicians are actually interested in engaging in a conversation about the use of marijuana as an alternative for pain control, they are not endorsing marijuana to be used recreationally. It's for a very specific patient for a very specific problem.
But the federal government won't even allow any testing whatsoever on whether the recreational angle or the medicinal angle. That has to change first, right?
So there are some clinical trials going on.
Okay.
And but one of the things that is really challenging about conducting those clinical trials is the amount of regulatory oversight and the number of regulatory hoops you need to go through. For example, if I were to do a study looking at medical cannabis for spasticity, which is one of the proven indications or one of the proven positive benefits is it can help with spasticity. So patients usually have a cervical cord injury or multiple sclerosis, they can get spasticity. And it seems that medical cannabis helps for that. If I wanted to do a study on that, I would first need to go to the FDA. Then I would need to go to the NIH, and they would give me the drug, specifically through NIDA, and then I'd have to go through the DEA. So if you think about those regulatory hurdles and be approved by our IRB, people are doing these studies, though, and they are going on.
So if someone is going to use marijuana for medical purposes, do they need a prescription to get it?
That's a great question, Tom. So the way that we've set a lot of the states up is that because it's illegal under federal law, It's a Schedule I medication, so it is illegal to give or recommend that drug for use in a patient. The way that they've set it up in Minnesota, for example, is physicians who are interested in having their patients explore medical cannabis for a therapeutic indication, they don't prescribe it. The physicians don't prescribe it. They certify a qualifying condition. And in Minnesota, those qualifying conditions are things like HIV, cancer, terminal illness, and now, as of July 1st, chronic pain.
Do you think that's enforced, though? Do you think? I bet that I could walk off this into one of these places where they sell medical marijuana and get it, even without your
Have you tried that, Dr.
certification.
Shives?
No, but I will for the next show.
We have one in town, and
Yeah.
you can test the theory directly. And but when you go there, and I've had patients who have gone there and told me the story. They go there, they sit down with the pharmacist, and they have a pharmacist that actually works in there, and it is a dispensary, but they have to have in the program in Minnesota, they have to have clearance and approval, and they have to be certified, and there is a fee that they have to pay in order to participate.
I think I'll try it in California
Okay.
before I try it here.
How safe is it compared to this opioid crisis that we have?
So if you look at the number of patients that died last year from opioids, 28,000, and then you hear the statistics of the number of patients that have died from medical marijuana is zero. So, but you need to look harder at those numbers too. I think it's a little bit challenging to get information about illicit drugs. I mean, opioids, at least the non-illicit types, or the ones that are not on street drugs, those actually have, they're prescribed by physicians. They're easier to track. It's much more challenging to get statistics and important vital statistics about drugs that are illegal, because patients may not be forthcoming, or users might not be forthcoming about their use.
One final question: can you get addicted to marijuana, whether you're using it for medical purposes or otherwise?
Great question, and when you look at the data, there about 10% of chronic users have some form of dependence, and the dependence we typically define as having withdrawal from it when you stop it. And you see about 9 to 10% of chronic users actually having a dependence on it.
All right, all about medical marijuana from someone who knows, internist and addiction specialist, Dr. John Ebert. Good to have you back.
Thanks.